Great. Thank you, Mr. Dango, for your comments, and thank you to the rest of the panel. I'd like to open the floor to the remaining attendees for any questions, and if you could just raise your hands. I think I'll take about 3 questions. We have Professor Renee English, who will conclude and summarize the session. I'm waiting to see hands. In the meantime, there is a thank you for posting on the chat box. Some panel members have been participating and responding to the issues raised today. There is a question, Prof. Dudley, that's asking, in what ways will a treaty have more power than the current IHR regulations, which member states have agreed on?
Did you want me to answer that question?
Yes, Professor Gostin, you can go.
Well, the IHR has had several major gaps. First of all, it doesn't deal with prevention. So the whole idea of animal-human interchange and zoonoses are not included in the international health regulations. But I think above all, the international health regulations have lacked, have not given the WHO the ability to, independently verify state reports, to hold states accountable, to monitor, inspect, and remediate actions. And so, in my view, the IHR is necessary, but it's not proven to be sufficient to meet the demands of a global pandemic. And so many have called for either a reform of the IHR or a more robust pandemic treaty. And so, I went through a series of content that the pandemic treaty could utilize if it wanted to. I think there's much that it can do. I should also add one more thing because it's crucial. The one thing the IHR clearly does not do is deal with transparency, scientific cooperation, sharing of pathogens, and most importantly, the equitable sharing of the benefits of diagnostics, therapeutics, and vaccines.
Okay, thank you, Prof. Gostin. I note there's a hand from Prof. Dudley. You can go, Prof. Dudley.
Okay. Thanks very much, Dr. Nkonke. I think my question was also about what what sort of teeth does a treaty have which the international health regulations don't have? Are there sanctions, and how is the WHO or the UN empowered to respond to countries that are not complying and are not demonstrating the kinds of solidarity and sharing that would be required?
I'm happy to answer that unless any of the other panel would like to.
It's not mine. It's either the delivery guy or the person packing the food at Chicken.
Go for it, Larry.
Okay, I will then. Well, Professor Dudley really points to one of the great inadequacies of international law. Mark Haywood also referred to that. International law has always had large difficulties in breaching, in getting sovereign governments to follow international norms. There are ways that we can do this. Human rights treaties and others use civil society monitoring, shadow reports, and things like that. With nuclear and chemical and treaties, We've often had independent inspectorates that could have access on the ground. Certainly the UN Security Council has the power to sanction governments, though sanctioning can be very good. But we have to kind of come up with, I think, the very best innovative compliance enhancing measures that we can. Maybe it's something like the PIP framework, which uses actually international contract law to bind parties, and gives WHO the power to exercise their contract rights. But whatever it is, I think we need the best international law minds to figure out ways to actually enhance compliance. We'll never get, full compliance, but we have to do a lot better than we are doing right now.
Dango, you can go.
Thanks. Just, an additional comment on accountability and international legal instruments is that one of the biggest gaps we find, whether it's in international criminal law or the international human rights regulations, international health regulations, is the lacuna in relation to corporations. If we want to see success, particularly in global health policy, we need to find, and perhaps this treaty can be the platform for this, seeing that we failed in Geneva and other spaces, is to bring corporations more firmly into the accountability loop as duty holders for human rights, and particularly in relation to issues such as the right to health and access to medicines. This is one of the areas where there's a great weakness, where we only hold states accountable, and where there's a huge disproportionate level of power being wielded by multinational corporations in how poor people, even in the north, but particularly in southern countries, access the means to realize their rights to health and their rights to life.
Great, thank you. I'm going to read one comment from Genga Peter Zawole. Building from below challenges the power and dynamics, and it requires effective consultations with those from below. How practical is this, especially in environments where those below are chronically ignored? Mark, would you like to tackle this? Or any panel member?
Yes, I will attempt to respond. I think we probably have to start engaging in the concept of co-creation, because in most instances, if we come up with new instruments that are just imposed without involvement of civil society, actually even at subnational level, we probably need to approach this from a co-creation perspective. This would be my suggestion. Thank you.
Okay, I see Mark's hand is up. Yes, Mark.
Yeah, I guess really the question is that I think there has to be a discussion about how do we build this power from below. And I keep citing the example of the HIV epidemic, where it was power from below. It was power from marginalized, disadvantaged communities that built political commitment, and which was able to take on the private power in relation particularly to the price of essential antiretroviral medicines. And once medicines became affordable, it started to change the whole dynamic around HIV prevention, give people a reason to come into healthcare systems, give a boost to the human resource base in certain healthcare systems, and so it had a beneficial knock-on effect. And civil society, people from below, took action and called out big pharma and pharmaceutical companies and turned this into a moral, human rights and legal question, which communities often won from below. But what concerns me about this treaty discussion so far, and about the response to COVID in total, is that communities have been bypassed in all of these discussions, and we need to find ways to bring them in. Otherwise, this risks just being an academic exercise. And I'd finish by saying this, is that, you know, we don't have a lot of time before the next pandemic. We don't have a lot of time before the crisis of climate change deepens in a way that impacts adversely on healthcare systems. So we have to have a plan rather than just a rhetorical discussion about the need to involve civil society. And I think, as Zane Dangle was saying, I believe there has to be an alliance between progressive social justice oriented developing country governments and communities on how we tackle this maldistribution of power in relation to global and national health.
Thank you, Mark. And now I'm handing over to Prof. English. Thank you.
Thank you, everybody. I'm left to the task of summarizing today's discussions, and I'm aware of the time, so I'll try and keep it short. We had 6 expert and seasoned presenters today, and the first speaker, Mane Bahame, who on behalf of President Mahama of Ghana, started by reminding us of the arrival of the pandemic and that it didn't come as a surprise, that pandemics have been predicted for many, many years. And in fact, the pandemic caught the world flat-footed, as he said, and to build on that, Precious had said, fast and ferocious is how COVID hit us. And it also revealed, the pandemic, that there were existing long-standing health system weaknesses as well as socioeconomic weaknesses, and that health systems were fragile, and that there was a need for a coordinated and collaborative approach to predicting pandemics and socioeconomic implications of these pandemics. And that requires intelligence, and it requires drawing on those with expertise to be able to warn and to help prepare for future pandemics. And he concluded by saying it's now time for a global health convention or agreement that is respected by all. That then moved us into Precious's presentation, where she argued that the international health regulations, which is an important legal instrument and is legally binding for all signatories, is possibly not adequate, and that it's time for a treaty that is not only of public health concern, but also of general public interest. And she asked the question as to how will we be able to address the various gaps that have been identified in the international health regulation. She also highlighted the fact that the international health regulations, because of its inadequacy, probably does necessitate the need for a pandemic treaty, building on Ohame Bahama's presentation. What followed was a summary of the findings of and recommendations of the Independent Panel for Pandemic Preparedness and Response, and Preeti Sudan presented the work and highlighted 2 overarching recommendations. Those were, first, that immediate actions were required to end the pandemic, and second, that we need to be able to prevent the future outbreak, a future pandemic. Underpinning point number 1 in terms of immediate actions is the need for vaccines for all, which is a priority. And this was located within the call for high-income countries to provide vaccines to low and middle-income countries, and for the World Trade Organization and WHO to convene manufacturers to agree to voluntary licensing and technology transfer. In her second point, a series of recommendations were proposed which span the need for immediate action for strengthening and elevating global health leadership and the WHO for investment in preparedness, for financial investments, for surveillance systems and data sharing across countries, for protocols to be put in place, for new tools and platforms and supplies to be pre-negotiated, and ultimately for effective national coordination. Lawrence Gostin, in his presentation, builds on this discussion around the need for something more than the international health regulations, and speaks about the need for building on a framework convention, which could very well be a good model for a pandemic treaty. He highlights, however, despite the flexibility that a framework convention can introduce, it too has flaws. And despite that, the flexibility does create more opportunity for countries to be responsive. He does, however, warn that we probably need a combination of a hard treaty and a soft law approach, and there needs to be some thinking around that. He concludes to remind us that the international health regulations focuses on what happens after the event, and what we really need for this treaty to be able to do is to focus on prevention, bringing in aspects around One Health, and ultimately concluding that a robust international instrument with robust norms and financing is required, but a lot of heavy lifting will need to be done to realize that. Mark Haywood builds on the prior speakers and highlights 3 preconditions for pandemic treaty, talking about the importance that this treaty needs to be located within honest and full assessment of the realities that are at play both globally and nationally, that we need to build on lessons learned from previous treaties, understand reasons for failures and omissions, and then finally, one of his key points, which is to not forget the importance and the role of civil society, and that we should be learning from HIV and AIDS response in terms of civil society's ability to shift at a local, the actions at a local level to shift what happens at an international level, reminding us that we need to link this in with the reconstruction of healthcare systems, and most importantly, that we need to see leadership from developing countries and developing nation democracies. Zane Dango acknowledges the points that are made and refers back to it and picks up on the matters that require consideration and touches on a variety of issues that center around power, resources, politics, governance at a geopolitical level. But he concludes by saying that what must be avoided as we move towards developing a treaty we must avoid protracted discussions regarding the treaty. And he stresses that UN specialized agencies for global health, particularly the World Health Organization, should be properly capacitated. They must be able to manage within the remits of the treaty, that we need to limit private sources for funding for WHO in particular. We need to introduce and consider that this treaty has to be a combination of hard and soft law, and particularly given that big global powers do not like binding treaties. I think the last point made by Mark Haywood really gives us food for thought as we move forward, and he consistently highlights the possible failures, or not failures, but the omissions of the work of the IPPPR, and the overarching take-home message would be then to balance both the bottom-up and the top-down approaches in order to address this problem, that we need a clear plan, not just a discussion in terms of how we would involve civil society. Regardless of our approach, civil society is critical for ensuring that we are able to respond effectively in a way that will ensure equity and health system strengthening across the globe. On that note, I thank you and hand back over to Lungiswa.
Thank you, Renee, for that comprehensive conclusion. And thank you, colleagues, for indulging us in terms of time. This webinar was recorded, and access to it can be provided to those who left early. Thank you to all the panel members also for their contributions and also for staying up until now. Enjoy your evening.
Lungi, can we just switch on all our videos? Can we just switch on all our videos and say bye-bye?
Okay. Okay,
Just
there's a
switch on all our
request from
videos.
Conchita.
Bye-bye.
Thanks, Zain. Thanks, Precious.
Bye.
Thank you.
Amanda, Bob, great
Thank
stuff.
you.
Bye. Thank you.
Ciao. Bye-bye.
Bye. Goodbye.
Bye. Thank you.
Bye-bye.
Bye-bye. Thank you.
Bye.
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 Omani, many thanks. Give our regards to our ex-president. Bye-bye, folks. Thank you.